So welcome everyone to our weekly Greenleaf Connect event. Today we continue our May series on mental health awareness in observation of Mental Health Awareness Month. We all know that our mental health can impact every aspect of our life and all of those around us. So today we welcome Mary Lane from Whitefoord Inc, who's going to speak to us about some very important mental health topics. Before we get started, we like to begin with our purpose here at Greenleaf Connect, which is to hold a forum for us to get together and talk about all things Greenleaf. Greenleaf Connect creates a space for us to be direct, informative, and build transparency for our audiences on specific and important topics like the one we'll discuss today. We also like to review our rules of engagement for our time together. So first, you can change your presentation view by moving the slider between the presentation and the speaker to make either one bigger or smaller. We do ask that you mute yourself during the presentation portion of our meeting to avoid any feedback as we present. And we'll hold a live Q&A session at the end of the presentation, so definitely have your questions ready for us. And a friendly reminder, this session is being recorded and will be made available on the Greenleaf Connect Workplace page for future reference. On our agenda today, Ms. Lane will go over some common mental health concerns, the differences between stress, anxiety, and depression, and some early warning signs, and how to prevent and manage concerns, and ways to get help. And as always, we will conclude with our Q&A and some important upcoming dates. So before I turn it over to Ms. Lane, I wanted to give you a little bit of background on her, as she's a very impressive individual. Ms. Lane received her master's degree in social work from the University of Iowa and is a licensed clinical social worker in the state of Georgia and Iowa. She's also an EMDR therapist and a certified alcohol and drug counselor. Mary specializes in working with depression, anxiety, PTSD, addiction, crisis intervention, and life restructuring, and has worked with adolescents, adults, and geriatric clients from varying backgrounds and life concerns. Mary has also worked in residential treatment centers, day treatment centers, nursing facilities, private practices, collegiate settings, and community outpatient clinics. So needless to say, we are very privileged and excited to have you join us here today, Mary. So I will now pass it over to you.
All right, awesome. Thank you all so very much for allowing me to be here, and I'm excited to get started. So as Natalie said, we are Whitefoord Inc, okay, and I'll get into more about what we do here. So our mission here at Whitefoord is to engage, serve, and strengthen community through health and education. Our vision is all in our community are healthy and children have what they need to succeed in school and beyond. All right, so this is, as you've seen on the first slide with Natalie, employee wellness, thriving in the workplace. That is me. Here are our objectives. So we are going to explore psychosocial, cultural, and environmental stressors, recognize stress, anxiety symptoms, warning signs, delineate diverse ways of coping, managing stress, and talking about self-care. So let's talk about what mental health is. And excuse me in advance if I don't say everything verbatim. I will try to, but I tend to paraphrase quite a bit. So what is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. I'm sure we all know that. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important in every stage of life, from childhood and adolescence through adulthood. And I wanted to put some facts here so that everyone knows that people struggle, we struggle, have struggled with mental health concerns. And this is where we have the differentiation between what is mental health, and then I'm going to actually talk about mental health concerns. And as you see here with this one fact, that in 2020, which was a heck of a year, if you will, but in 2020, about 1 in 5 American adults experienced mental health issues. Now, that's not uncommon because even before 2020, the stat was 1 in 5 people struggle with mental health concerns. So that has maintained, that data has maintained throughout. 1 in 6 young people experience a major depressive episode. And here you see this last fact, with suicide is a leading cause of death in the US. And in fact, it was the second leading cause of death for people ages 10 to 24. That's an astounding stat there, but it also unfortunately has remained true throughout and over the years. Okay, biopsychosocial and cultural stressors. Biological factors such as genes or brain chemistry, life experiences such as trauma, abuse, and family history of mental health problems. So if you have heard that, your family history plays a role in whether or not you may be more susceptible to mental health concerns, that in fact is true. Internalization of emotions. So here I wanted to talk about how you might perceive yourself at times. We often, while we experience positive emotions, we also experience negative emotions and thoughts. So negative thoughts are often seen as weak or embarrassing. Negative thoughts are less often expressed, obviously. This can lead to feelings of depression, loneliness, and emotional outbursts. Okay. Feeling stress. People often use blanket terms to express how they're feeling, and I thought it was important for us to talk about the differences between stress, and as the objective said as well, and in the agenda, stress versus anxiety versus depression. Because when we're going through life, you might seem out of the ordinary, right? And somebody might ask, how's it going? And you say, I'm just stressed out. But that is often is a blanket term to really describe, it doesn't really describe how we are feeling actually. It can, but it's not the end all be all. There are other emotions and processes there, or that can be there. So stress is often used as a blanket term. But what is stress? So stress is any type of pressure or tension brought on by adverse life events. And I also wanted to just state here that oftentimes when people talk about or ask about trauma, I say adverse life events, anything that affect your ability to cope, right? So stress, trauma, anxiety, depression, you can see how they can all go hand in hand. So stress is any type of pressure or tension brought on by adverse life events. Stress can present itself in various forms, emotionally, physically, and psychologically. How to know when it's more than stress. As I stated earlier, when your ability to function is jeopardized, anything that affects your ability to cope. That's how you can pretty much know, hey, this is something more than just stress here at work, or it's more than that, something else going on. So that's where we start to assess. So here we go. This can present in the form of emotional distress, depression, anxiety, sleep disturbance, interpersonal stress, so relationship problems perhaps, substance use, maladaptive coping skills, and decreased social functioning. Anxiety. What is anxiety? Excessive worry, fear, worrying about the future, inability to control, worry, and feeling of doom. Common types of anxiety are generalized and social. Those are the two common ones. Generalized anxiety is you're pretty much anxious more often than not on the daily happenings, the daily events and such. Nervousness or often on edge. Social anxiety, again, is focused on being out in the environment, feelings of embarrassment, judgment from others, and dread in social situations. Depression, chronic state of sadness, feeling down, hopelessness, worthlessness. Feelings of failure, suicidal thoughts, self-harm behavior, and isolation. When to know if there's a problem, okay? So there may be a problem if harm to self or others is present, talks about dying, feeling of hopelessness, psychosis, okay? And that can include auditory or visual hallucinations. Increased substance use, isolation, poor sleep, increased sleep, and mood swings. Prevention is key, okay? Mental health concerns are treatable. Mental health concerns are treatable. Recovery is definitely possible, okay? So how to help prevent? Pay attention to your emotions and feelings. And I know it almost sounds counterintuitive. However, a lot of us are not as mindful to our own emotions and feelings. We may be more mindful to others. We may know we may know how to care for others, but when it comes to ourselves, we may not do a very great job at that. So pushing things to the side, stuffing things down, repression, suppression, that is all not paying attention to our emotions and feelings. And in order to help prevent mental health concerns, we want to remain mindful. Okay, take inventory of stressors and life events that are particularly negative. If there's something in your life that you know isn't quite right and is contributing to mental health concerns, that would be something to take inventory of. Managing stress and upset. Talk with a trusted friend, family member, or loved one. You probably heard this one a lot. Exercise, eat a balanced diet, connect with others, help build a support system that works wonders, just have to say. Building a support system, whether it's something that is natural. So natural would mean family members, that would mean family members, friends that you're close to, loved ones, things like that. But also there are some of us who have to build support systems and they're external. So people that we come up with and grow to love and grow to care about, we may often have those as support systems as well. Doing things that you enjoy, develop coping skills. That's what we talk about when we refer to coping skills some of the times, doing things that you enjoy. Seek professional help, right? Helping others. This hits home for a lot of people. I don't know if any of you have experienced needing help or at least helping others, but this for sure is something that people ask about a lot. How can I help, my family member? How can I help my friend? How can I help my child? And so these are some ways here to help. Pay attention to the warning signs and symptoms. So earlier, isolation, increased sleep, poor sleep, feelings of wanting to die, talking about death, hopelessness, things like that. Be straightforward with your concerns. It's very helpful to express how you're feeling right on. Don't beat around the bush too much, because as much as you want to be clear in your concerns, you also want them to be clear in what it is that they might need from you or want from you. Discuss concerns in a safe and appropriate manner. Watch for nonverbal cues on when to slow down or backtrack, okay? So if you see that the person is getting upset or is confused about what it is that you're stating, then maybe take a step back and maybe reframe or ask what it is that they might do. Situation. And the last one here is listen, listen, listen. Okay? All right, so some things that you can ask. This is how you can ask what's going on, simply. So it seems like you're going through a difficult time. How can I help you? How can I help you find more information about mental health problems? I'm concerned about your safety. Have you thought about harming yourself? Things like that. But here are some examples that you can use if you are concerned about a loved one. Types of mental health professionals. This one is often confusing for people. And so I'm going to talk about common mental health professionals. So counselors and therapists, that language is used often interchangeably, but simply means the same. Clinical social workers, psychologists, substance abuse professionals. So this consists of talk therapy, and also these professionals can provide psychiatric, psychological evaluations. They can also do testing, psychometric testing and things like that when it comes to assessing for certain mental health concerns. Okay, so a counselor, someone says they have a counselor, they're likely doing talk therapy. If someone they have a therapist, they're often doing talk therapy as well. And then in special situations, like I said, these psychological evaluations and such. So medication management, that would be psychiatrists, psychiatric nurse practitioners, and of course, as you may know, medical doctors. So in the case for mental health, oftentimes people go to their doctor, their PCP, to see what's going on with me, right? Or what's happening. It might be a mental health concern. And the PCP oftentimes will refer to a psychiatrist because they have the specialization in mental health. Generally, the general practitioners, the medical doctors, they don't want to continue a person on psychiatric medication because they're not trained and they haven't specialized in that area. But psychiatrists and psychiatric nurse practitioners have. So that's medication management there. And here, the last bullet is therapy can be individual, families, couples, and how to find us. So first one I put here because you all are with Greenleaf is seeing if you all have the benefit of Employee Assistance Program, also known as EAP. EAP, depending on the contract that may be in place with your employer, you can get about I've seen 5 to 8 sessions free. So that means 5 to 8 sessions free per issue. So if it is a benefit of your employer, you could get help with with finding a mental health professional, and you can go see them free for that amount of time per the contract. And then if you wish to continue services, then of course your medical benefits will kick in, and you might have a co-insurance or you might have a copay. But that's often a way to get in the door, if you will, because you don't have to worry about the financial component right off. And it's something that's confidential, and it's a great benefit if your employer has it or offers it to you. Next one, of course, is medical insurance. So the best way to go about finding mental health professionals, I would say outside of the EAP program, is to inquire of your in-network mental health providers. So they have everything online now, as you know. You can sign on to your insurance plan online and look up the in-network providers there, or you can always call and ask, hey, what are my mental health providers? And they will gladly send you over a list of them to your email. Online resources. So again, I know everything is online. A lot of us are working from home, doing virtual things. And so Talkspace, BetterHelp, I know you've seen the commercials. That's a way that you can also seek mental health professionals. And these people are certified and licensed as well. Internet search, good old Google, if you will. You can just put in Google there and find local communities, local agencies there. I was thinking of community centers, but local agencies that offer mental health or behavioral health, as you might often hear it referred to in your medical insurance. They might differentiate with behavioral health. But anyway, you can see behavioral health agencies like Whitefoord, if you will. In Whitefoord, you see this FQHC. This stands for Federally Qualified Health Center. And essentially what that means is that we have, good old standing with HRSA. And that just means that we offer a sliding scale. We offer discounted services, and anyone can come here, and we do take insurance, but we offer services at a discounted rate as well for people who are uninsured or underinsured. So there are plenty of FQHCs here in the Atlanta area. And so feel free, certainly, because when we talk about finding a mental health professional, the question that usually follows is, how can you pay for it? And if you know someone who is not in the best financial standing right now, FQHCs and other agencies are around here in the Atlanta area to help them. So that's a great way to help people find a mental health professional. And here are some behavioral health resources here. So you have the behavioral health link. Some I wanted to point out, particularly is the crisis line here, Georgia Crisis and Access Line. Here's the 1-800 number here, available 24/7. Okay. The other one, there is also, where is it? It's afraid to move too fast. So the National Suicide Prevention Lifeline here you'll have all these at your disposal, I understand, but I want to talk about these here. The crisis line. So the National Suicide Prevention Lifeline is amazing. The number is 1-800-273-TALK, 1-800-273-8255. They are amazing. And they also have crisis chat. It is just wonderful. It's just wonderful what these volunteers, I used to volunteer as well at a crisis center and volunteer for the crisis chat. So it's wonderful people that are volunteering and that are ready and able to hear your concerns or hear your family members' concerns. So please get this information to anyone that you think might need it. And that's the Georgia Crisis Line. Just wanted to point that out. And then also the National Suicide Prevention Line as well, and some other resources here. Okay, so what do we do here at Whitefoord Behavioral Health Wise? Excuse me. We provide screening and assessments, individual counseling, family counseling, crisis intervention, psychological referrals, and follow-up. Psychiatric and medication management. We do have a psychiatrist here on staff. Case management and coordination of care. And these are our locations. So in the beginning, you heard me talk about students and having the students feel healthy and all that, and the mission and the value. And so as you see here that we have a school-based health center, and that's actually how we got started, is school-based health. But this is where I am here, the 1401 Hosea Williams Drive. And we have Whitefoord Early Learning Academy just across the street here. And Toomer Elementary School-Based Health Center. I have a coworker, a social worker who's there. And we have, I'll get to that, I'm sorry. And the Martin Luther King Jr. High School, she is there as well, the social worker. So she goes to the school and provides therapy. They've done groups there as well in the school. And back up here, the Whitefoord Health Center. So I know this is behavioral health, but we have, so of course I'm here, we have the psychiatrist here, but we also have nurse practitioners, nurses, family doctors, pediatricians here as well. So we operate at an integrated level, and we have dentists, we have dental as well. So we really try to get the whole family in. We try to get people taken care of physically, emotionally, and psychologically. And then also at the schools, we have nurse practitioners there as well as our social worker who's there. And this is my contact information if you want to give me a call. Okay. Questions?
Great, thanks, Mary. This is such valuable information for us to know and to keep talking about. So we have a couple pre-submitted questions for you. So first, if I do need help, how long does counseling usually last?
Yes, great question. So counseling lasts for as long as it needs to last. Now, there are some practices that operate in short-term or brief counseling, but pretty much it lasts as long as it needs to. You can stay in therapy for 6 months. You can stay in therapy for years. There are people who come to, who attend therapy for years, and they might come at a weekly basis. They might come twice a week. They may come monthly. They may come however is appropriate, whatever is appropriate for them. But that is a common question that we get. So we help until we provide skills. And sometimes there's another issue, right? So we know that there may be stuff going on at home. There may be stuff going on at work. There may be relationship issues, parental issues, and things of that nature. So things just tend to happen that way. So you might be going to therapy for 6 months, be doing well, and then something else comes up and you want to express and unload. So it takes as long as it needs to.
And then you talked about Whitefoord offering like a sliding scale or for your discounted resources. But if we personally don't need financial assistance, can we still visit Whitefoord?
You can still visit Whitefoord. Yes, that's
great. The last is kind of like an open discussion, but for me, I think it's important for us to talk about the myths of mental health concerns and how, it's just like if you hurt your knee, you're going to go to the doctor to get help. And so when it comes to mental health topics, it's something that we shouldn't be afraid to talk about. It is a norm. And, so for us at home and in our friends group, to make sure that those around us feel comfortable and know that it's something that we can talk about, and creating an environment where people do feel comfortable, especially coming to us to talk if they need help. Like you said, as far as suicide rates and things like that, and school shootings. And, it's just like if we talk about what we see in front of us and try to offer help or provide additional resources, it could save somebody's life. So do you have any kind of tips as far as creating that type of open environment to talk about these types of things?
Yes, my first tip is to be as open and welcoming as possible. Please refrain from using words like crazy. We often we almost say it and don't know that that it's such a strong and negative connotation towards it. We just use it so casually nowadays. But really just know that you don't know what someone else is going through or have been through. And you might think that a person has it all together, but they may be struggling emotionally. And so it's very important just to be as open and welcoming as possible. Certainly, if you can create an environment that's warm. And if you don't feel comfortable, you yourself, then please try to get them to the nearest professional, someone that can really help them. But I think, really being open, listening, listen. Sometimes we get caught up in our own stuff and we want to just go on, but really create an opportunity where you can listen to others. But certainly, know that mental health concerns are as common. You saw that 1 in 5 that has remained throughout. Before 2020, that statistic is pretty much consistent there. Suicide is very much real. It's very real. And these are only the cases that we know of where we're getting the data on. So please just be mindful of how you're interacting.
And I think also, like with the adolescent age group, is that even if they don't feel comfortable talking to their immediate family or their parents, of just having the conversation that if you don't feel comfortable talking to me, there's somebody else that you can talk to. Because so many people that are suffering from a mental health concern feel so alone, and they're ashamed and don't want to talk to those that are close to them. But like you said, talking is one of the best ways to approach a mental health concern and start getting help.
Yes. And children experience mental health concerns too. That's often the myth that, oh, you can't, you're 10, and that's just untrue. Mental health, it carries across the life.
Great. Well, those are all the pre-submitted questions we have. We'll go over our upcoming dates. Bear with me, we have a lot going on in the coming weeks. So first, just a friendly reminder about open enrollment. Open enrollment does end next week on May 19th. So a plug there to go online and TriNet and look at the benefits available to you. Even if you want to keep your same benefits, we suggest that you go online because there are some price changes coming into effect this year. So go on there and see what that would be for your plans. Then, as always, this recording will be made available tomorrow afternoon on Workplace. And then Kat sent out a calendar appointment yesterday for our $100 million in asset acquisition celebration. So we hope you can join us for that on the 25th from 4 to 6 p.m. The address and all the details are in that calendar appointment. Then a reminder that Greenleaf will be closed on May 30th for Memorial Day. Then we have a lot of cool volunteer events coming up. So first, we have a private American Red Cross blood drive on Tuesday, May 31st, so right after Memorial Day, from 11 a.m. to 4 p.m. And that's going to be at the station in Building 65. So that's where we had our Halloween event and our investor event. So if you want to sign up for that, I did post on Workplace the flyer that has the QR code that's also posted all over our office, but you'll just use your phone and follow the QR code to sign up for a time slot that day. You do need to sign up, so please follow those directions. And then a tentative date, but on Tuesday, June 14th, we're going to partner with the Fire Station 16 on a landscaping project. This is the fire station that services the Fairway neighborhood. So we're looking forward to giving back in that community. Then if you joined us for Josh's presentation on Camp Greenleaf, that's going to be at Park Hill. That's Monday, July 25th through Friday, July 29th from 9 to 12. We did send out a sign-up form for that so that you can let us know what days you want to participate. There are time blocks. You can participate all day. You can participate in an hour time block. And then we also ask that if you would like to participate in an activity with the kids, to go ahead and let us know what that is, and Josh will touch base with you on that. And then a reminder that coming soon, we have our new survey and recognition system, Kazoo, that we learned about during Goal Week. Okay, for our Greenleaf Connect schedule, next week we'll discuss ways to maintain good mental health, and then we'll close out the month on the 26th with Amina Porter, also from Whitefoord, who will review the topic of recognizing signs of substance use with us. And last but not least, our friendly reminder to log into our Kudo platform to start some exciting development programs. As we previously announced, Kudo will be a part of the Kazoo point system. So you will get credit for completing any Kudo courses when we start the recognition program. But if you have any questions about the system, the programs, logging in, or anything like that, just reach out to me and I'll be happy to help. So thank you all again for participating in today's session, and we look forward to seeing everyone next week as we continue our mental health awareness series. Thanks again and enjoy your day.